Hi, my name is Dr Azura binti Daniel. I'm a clinical oncologist at KPJ Ampang Puteri Specialist Hospital. Neuroendocrine tumor or NET is a rare type of cancer or tumor that can develop in different organs in the body. It affects cells that release hormones into the bloodstream, which are the neuroendocrine cells. Neuroendocrine cells are widely distributed throughout the body. Therefore, NETs can occur almost anywhere in the body. NETs are not like lung or liver cancer, which affects the older population in their 50s and above. Most NET patients are younger, in their 30s and 40s. Symptoms depends on where it is in the body and what hormones it produces. In the early stages, most NET cancers doesn't cause any symptoms at all. By the time symptoms show up, the cancer is quite advanced. Symptoms include tumor in the digestive system, or GI NET causes prolonged diarrhea or constipation or progressive abdominal pain. Tumor in the lung will cause wheezing or persistent coughs. Some tumors may cause what we call carcinoid syndrome, which presents with chronic flushing, diarrhea, cramps, wheezing, low blood pressure, and heart problems. This is due to abnormally large amounts of hormone being released into the bloodstream, and this is primarily associated with tumors arising from the small intestine and proximal colon. Other symptoms include unexplained weight loss, rectal bleeding, insomnia. NET may mimic or share similar symptoms with other conditions such as irritable bowel syndrome or IBS. IBS may cause chronic diarrhea and abdominal pain as well, and it's not surprising that GPs often think of IBS when they see patients with intestinal problems, especially that these are patients in the younger age group. Sometimes NETs present with abdominal pain, and in younger female patients, it's possible to misdiagnose NET as endometriosis, a condition where the uterine lining grows outside the uterus. It is also possible for older females to link hot flushes and mood changes due to premenopausal symptoms and not think that it is a disease. You should see a doctor when these symptoms persist and do not respond to the treatment or to the medication that was prescribed. This indicates that you need further tests. Many tests can be used to diagnose NET. Usually, the initial test will include blood and urine investigations. The blood test may check for abnormal levels of certain proteins such as chromogranin A or CGA level, which may be elevated in NETs. This test can also be used to monitor treatment as well. Urine tests may check for a 24-hour urinary excretion of 5-HIAA, which is the end product of serotonin metabolism. And this test has a high sensitivity and specificity for carcinoid syndrome. Some patients may require an endoscopic or colonoscopy examination. We would then follow up with an imaging investigation to look for tumors. Imaging tests include ultrasound, X-ray, CT scans, MRI, and also a special imaging test more specific for NET called octreotide or dotatate scan. This is when a mildly radioactive liquid is injected into your veins and a scan is used to highlight any cancer cells. Finally, you will need a biopsy to confirm the diagnosis of NET. NETs are unlike other cancers as they are often slow growing. They are staged differently and also treated differently from other cancers. Staging for NET depends on the site of disease, the grade of the tumor, and the differentiation of the cells. NETs are graded into grade 1, 2, or 3. Grade 1 are low-grade tumours with cells that divide and grow slowly. Grade 2 is intermediate and Grade 3 is high-grade with fast-growing tumours and rapidly dividing cells. The degree of differentiation describes how the cancer cells look, whether they look similar to healthy cells under the microscope or very different and mutated. Well-differentiated cells maintain some qualities of healthy cells, while poorly differentiated ones look and behave very differently from healthy cells. Generally, the lower tumor grade and degree of differentiation, the better it is for the patient. Unlike other cancers, the majority of NETs are slow-growing. Patients often live for many years with the right treatment and care. Treatment depends on individual circumstances such as sites of tumor, stage of disease, and overall health of the patient. In general, surgery would be the main treatment to cure the disease. However, in many patients, NET is diagnosed after the tumor has spread to other parts of the body, especially to the liver. In this situation, a medicine called somatostatin analogues, SSA, such as octreotide or lanreotide, may be recommended. This medicine stops the body from producing too much hormones and can reduce the severity of symptoms and delay tumor progression. Studies have shown that this treatment has a significant advantage in terms of progression-free survival. If the disease becomes resistant to this treatment, then other treatment modality may be used. PRRT or peptide receptor radioligand therapy is another therapy that delivers targeted radiation to the NET cells, destroying the cancer cells but leaving normal cells largely unharmed. Other treatment options include transarterial chemoembolization, chemotherapy, and targeted therapy. With the right care, NET patients can live long, full lives. However, good survival rates depend on early detection and timely treatment. I would advise patients to consult a specialist if they experience any of these symptoms that do not respond to treatment. Firstly, diarrhea, abdominal pains, hot flushes, insomnia, wheezing, abnormally low blood pressure, unexplained weight loss, and rectal bleeding. It could be NET.